Good morning, everyone. Good morning, good morning, good morning. Thank you guys so much for being here. I wish I had a way to count all of you. I think this might be our largest session yet, which is fantastic, so welcome. Those of you that are still coming in, there's straggling chairs at different tables, so just find what you can. My name's Melissa Marshburn. I'm the communications specialist for MeckLINK, and I want to start off with a big thank you for those of you that participated in our Field for Hope. MeckLINK did a garden. We planted sunflowers. If you're interested in seeing them, it's off of North Davidson and 17th Street. They'll be growing all throughout the summer. We'll be donating the grown sunflowers to a pop-up market called Go-Go Fresco, and the money raised from that will go to different nonprofits and missions for mental illness, intellectual developmental disabilities, and substance abuse. It was a fabulous event. The sunflower seeds on your table we packaged for you so that you could take them home and plant sunflowers in your own garden as a symbol of your participation in working towards reducing the stigma associated with mental illness and depression. So we hope that you'll participate in that. How many of you knew this week that President Obama and the White House got on board with mental health in this country? Huge, huge thing. There's been so many people that have been working towards that for years and years, and it was wonderful. And I wanted to announce actually that MeckLINK was invited to participate in the launch of the community website that was started. There will be different pins on this map, and if you go and you hit one of the green pins, the one in North Carolina, the only one in North Carolina right now, is connected to the people in this room. I think that deserves a round of applause. What this means is that as a community, we're going to talk a lot about community today. And as a community, we will be working with our city and our county and all of the different departments, like the health department, the school systems, the jails, the sheriff's department. And the goal is going to be to all get in a room and decide how we want to participate in mental health in our community. And this project will go on over the next 18 months, and we will be collecting a lot of data and putting a lot of information on this website so that we can educate people in our neighborhoods and in our own homes about mental health. Next, I want to show a video. How many of you have ever heard of the Kid President? Oh, this is going to be fun for y'all.
I think we all need a pep talk. The world needs you to stop being boring. Yeah, you. Boring is easy. Everybody can be boring, but you're gooder than that. Life is not a game, people. Life isn't a cereal either. Well, it is a cereal. And if life is a game, aren't we on the same team? I mean, really, right? I'm on your team, be on my team. This is life, people. You got air coming through your nose. You got heartbeat. That means it's time to do something. A poem. Two roads diverged in the woods, and I took the road less traveled. It hurt, man! Really bad. Rocks, thorns, and glass. My pants broke. Wah! Not cool, Robert Frost. But what if there really were two paths? I want to be the one that leads to awesome. It's like that dude Journey said, don't stop believing unless your dream's stupid. Then you should get a better dream. I think that's how it goes. Get a better dream and keep going. Keep going, keep going, and keep going. Will Michael Jordan have quit? Well, he did quit. No, he retired. Yeah, that's he retired. But before that, in high school, what if he quit when he didn't make the team? He would have never made Space Jam. And I love Space Jam. What will be your Space Jam? What will you create will make the world awesome? Nothing if you keep sitting there. That's why I'm talking to you today. This is your time. This is my time. It's our time. We can make every day better for each other. If we're all on the same team, let's start acting like it. We got work to do. We can cry about it, or we can dance about it. We were made to be awesome. Let's get out there. I don't know everything. I'm just a kid. But I do know this. It's everybody's duty to give the world a reason to dance. So get to it. You've just been pep talked. Create something that will make the world awesome. Play ball. Oh, hi everybody. We're all working hard to make this an awesome year for other people. And you guys are doing it. You've been super encouraging to me, so I want to return the favor. Who you know who needs some encouragement? Pass this pep talk along and let's get the whole world to dance. I'm dedicating this video today to my friend Gabby. She's a cool kid, she likes pancakes, and she's fighting cancer like a boss. And to all you watching, who encourages you? Send them this video and let them know. So get to it. Bye.
So pancake, subscribe.
Not cool, Robert Frost.
So I don't think I have to tell any of you why we're all in this room after that video. I think it's pretty sure that everybody here knows that we're all here to speak for the voices that we all work with and for, and that the numbers are the thousands and thousands and thousands of consumers that we work with every day. And that video is to open up something that I want you guys to take with you and think about for the next couple of weeks before we come back and meet here on July the 10th. We're proposing a community tagline that all of us would use. MeckLINK, your companies, your individual practices, a tagline that represents how we feel about the people that we represent and what we want them, what we're here for, their success. So if you don't know the definition of a tagline, it's basically, it's a slogan or something memorable that people can relate to, and they it produces emotion or something that makes you go out and act and do something. So a couple of examples of these are going to be very familiar. Cigna, a health insurance company, is Go You. Right now, Carolina's Healthcare, it's all over the television. Power of One. AT&T, we all know that one, reach out and touch someone. American Express, don't leave home without it. Bounty, that was one of my favorites, the quicker picker-upper. Office Depot, taking care of business. And Allstate, are you in good hands? So I've got my email address up there, and what we'd like for you to do is, among your teams, to sort of think about our community, how you feel about it, what the goal is, and help us to define how we can represent ourselves as a community as we go forward over the next 18 months in producing different events and forums and opportunities for the community to come out and learn more about what y'all do and learn more about mental health. Now, I would like to introduce our leader, our awesome leader, Phil Indris.
Good morning. It's really great to see everybody here today, and it's kind of hard to follow Melissa and the KID president. You sort of maybe want to go before them so that you're not compared to them, because there's no way you can be compared to the KID president. And I certainly can't dance like that, and you wouldn't want me to. But his message is absolutely spot on, in that we really need to come together and work together as a community to address the many issues that we have in our system and the challenges that are faced by all of our consumers. And that's why we're here today, is to be able to come together and talk about amongst each other and to have communication with us about the issues and the challenges that we face. And to become energized by that. One of the things that we're going to be focusing on at MeckLINK in the next few months is a change in governance. The House on Monday approved Senate Bill 208. It was sent back to the Senate yesterday and was approved. And whereas MeckLINK is currently embedded in county government basically as a county department and as a county program managed and overseen by the Board of County Commissioners, Senate Bill 208, among other things, in terms of establishing accountability, ruled that MeckLINK could no longer be embedded in county government. So we will have to, in the next 6 months, or 6 months and 25 days, but who's counting, establish an authority similar to what governs all of the other LME MCOs, with an independent board moving forward. We do not yet know exactly what that structure is going to look like and what all of the ramifications are going to be. But what we have to do is to continue to focus on what our mission is. And our mission at MeckLINK is to talk about the 5 rights. I don't know if that's up there. 5 rights. The right service to the right individual at the right time for the right outcome, and hopefully at the right cost. But we really do need to focus on the 5 rights right now. And we have a lot of services in this community. We have, as you can tell by all of you here today, we have a large number of providers of services. We want everybody to succeed in this. This is about succeeding together, coming together as a community to succeed. And how we succeed is by making sure that the individual consumers and kids and families and adults that we serve get the right service at the right time. This is not about engaging individual consumers and families and kids in services for extended periods of time moving forward. This is about being very strategic in our interventions, so that as a managed care company and as a managed care service system, and as the community owns us as part of the network, this is a partnership between currently county government, soon to be the area authority, and you as providers and consumers and family members coming together to decide what are the services, how are we going to engineer and provide these services in a way that's going to address the needs of the individuals and allow them to progress with their lives. It's not about being involved in their lives for extended periods of time and having people dependent upon us. If we engage in that, the individual is not successful, and as a system, we're not successful. It's really about the right service, being very strategic about that to achieve the right outcome for that individual, and allowing that individual to mature and to grow over time and to achieve their full potential. That's what this is about. The managed system is just a different way of trying to finance and incentivize that, the system and you as providers to get to that point. It's not about trying to put people out of business. I keep hearing that. Now, last night I went to the Board of County Commissioners, and I think it was the first time that I did not have a question from a board member. Are we deliberately trying to put people out of business? They had other issues, but that was not first and foremost on their agenda last night. And so I want to make that perfectly clear, that this is not about saying, well, we're going to eliminate 90% of you or 80% or whatever. This is about providing the appropriate service to the right individual to achieve the right outcome. What we're going to learn about a little bit later this morning from provider operations is the Gold Star program. And part of that is going to take into account achieving the outcomes. It's about quality improvement. How are you as an agency measuring the change in behavior and functional level of the individuals to whom you are providing services? But again, this is not about doing it on an individual basis and just a contractual relationship between MeckLINK and you as providers. This is about all of us coming together as a community to address the needs of our citizens and the residents of this county. And I encourage you to participate in our community dialogue. We don't know exactly what form it's going to take, but it's going to be, as Melissa said, an 18-month effort to begin to address stigma. But it's also then, in addressing stigma, what we're doing is we're saying that people with a mental illness or a cognitive impairment or a substance abuse problem can lead and be productive in this community. And in doing that, we will be addressing the stigma. So that's what the conversation's about, but it's really going to take all of us coming together, working together to achieve the right outcomes for the right individual at the right time, and moving that agenda forward. So again, I'm thrilled to see so many people here today, and I look forward to working with all of you moving forward as we take on the challenges of the future. Thank you.
I know that there might be some of you here today who don't even know what a CFAC is, so I always feel obliged to say a little something about what CFAC is. It's the Consumer and Family Advisory Committee. It's a committee made up of volunteers who are consumers and family members within the system, and we volunteer our time to sit on this advisory committee that is actually mandated by state law. Every MCO LME must have a CFAC, and I happen to be the chair of this one right now. So I want to sort of continue the theme that Phil started, but with a little different slant, since I am the parent of an adult daughter who has significant developmental disabilities. I think we all, I certainly know that we've had a rough ride for the past several months here in Mecklenburg County in a variety of ways. And based on what happened yesterday, it doesn't look like it's going to improve anytime soon in terms of having some sort of peace in this system. And I think we've all been, I know I have been really frustrated by it and very dismayed by some of the things that have happened, as I've ever been. And I've been doing advocacy work for over 30 years. And I expect that a lot of you feel the same way. And I consider a lot of these things really a threat to the system that so many people have spent such a long time trying to build in Mecklenburg County. to have something that we're all really proud of. So it's been frustrating to me. And more than one time I've walked out of a meeting and thought, I just need to go home and walk the dog and read a book and stop doing this because it's so frustrating. But I was in Winston-Salem last week, and I wanted to tell you a little bit about that because you probably didn't hear about it. There was a meeting in Winston-Salem last night that the Centerpoint CFAC put together, and it was people, CFAC members from all over the state of North Carolina were there, over 100 CFAC members. And the meeting was put together so that Secretary Voss and Carol Steckel, who's the director of DMA, would come to that meeting and answer questions that the CFAC members had prepared. And I know our CFAC spent half of one meeting talking about what questions we wanted to ask the Secretary and the director of DMA about what's going on in the system, and especially about the new reform, yet another reform. And then, so we found out, though, less than 24 hours before the meeting, that they weren't going to come after all, that they were going to go talk to the legislators about budget. And so we all had traveled to Winston-Salem to talk to them, and they weren't there. And instead, they sent Dave Richards, who had been who had been the director for like 2 days. And they sent out Jim Gerard, who was the standing in before Mr. Richards came in. And then 2 young women from the Division of Medical Assistants, whose names I can't remember, who had worked for DMA for 6 or 8 months. So it was a pretty unfulfilling moment, because not only did the secretary not come to answer our questions, she did not send answers to the questions that we had carefully crafted for her to respond to. And the people who were there couldn't answer anything, and Dave Richards got kind of tired of saying, I've only been on the job 2 days, folks. But basically we got no answers, and all these people had come to learn and walked away disappointed. So I found myself in that meeting it just got worse and worse because I was so frustrated. And then a woman from one of the other CFACs stood up, and because I think it was maybe Dave Richards said, how appreciative he was that over 100 consumers and family members had come to this meeting. And this woman stood up and she said, you need to know that there aren't just 100 of us here. There are all those people behind us who are not in this room. There are hundreds and thousands of consumers who are not in this room, and that's who we're here for. So, so when I heard that, I thought, okay, all right, let's get back at work. And so that's kind of what I wanted to talk about a little bit today, because I was just reminded of why we were there in that room and why all of us are here in this room, because we're not here just for ourselves. We're here for all those people that we care about, because you came to this work because you had a vision and a passion for it, and I do too. And so that's why we're all here. And it's about all those people who are not in this room. That's why we're all here today. So what I'm thinking about, and based on what Phil said as well, is what I want us all to say really firmly fixed on it is that it's not about us, and it's not about our personal agendas. It's not about our agency. It's about the people whose lives we're trying to improve. And that's what this is about. And I think that if we're not working together, that we're going to do a disservice to those folks, because if we have competing agendas, it's not going to help these folks that we need to, that you need to help. And I thank you for that, because you do it every day. And I think we forget to say from time to time what great work you are doing every single day. People are getting better and they're being more independent. And that's why we're all here and why we came to this work. But they're going to be shortchanged if they're competing agendas. And so I just wanted to make an appeal for you as providers to work together and to work in a good, strong partnership with the MCO, so that whatever happens in the next 12 months, and who knows what that's going to be, so that whatever happens, that it continues to contribute to consumers getting better and having more independent lives, because that's all that really matters, and all that matters to me at the end of the day, and I think it's all that matters to you. But it's easy to lose sight of that in the middle of all this stuff that's going on. So I'm just going to encourage you to continue to work together and to really be a strong partner with the MCO staff, and keep that consumer in the center of your thoughts.
Hello, good morning. My name is Damian Chisholm. I am the current president of the Mecklenburg County Provider Council. We are hearing a lot this morning about Senate Bill 208, particular emphasis on Section 4. I have had brief conversations with MeckLINK, and we will be putting together several focus groups between now and then. I'll probably be contacting Chuck. Our next network development subcommittee meeting will be June the 19th at 10:30. And I am asking for feedback and suggestions regarding the agenda. If you could send that information to me or either Sherry Wright. Sherry, if you could please stand and wave your hand so folks can see who you are. We are the co-chairs of the Network Development Subcommittee, and we will be putting some focus on moving forward with this initiative to see how we can better work together as a community with all the providers as well as MeckLINK and the county commissioners. So again, if you can get me some information, we'd be much more appreciative. And again, that's June the 19th at 10:30 at 601 Hickory Grove Road, and it is Hickory Grove United Methodist Church. Thank you.
For those of you that I have not met previously, I'm Dennis Knazel. I'm the Director of Provider Operations, which is a division within MeckLINK Behavioral Healthcare. What I thought we would do for a few minutes this morning, since obviously we've been going through a lot of restructuring internally, is to give you some sense of who we are as a division and what our responsibilities and tasks generally are on a day-to-day basis, to introduce you to my management team, and to have the managers introduce you to our staff within Provider Operations. So, I guess I'm supposed to do something here. I don't know. Okay. So within Provider Operations, there are two sections: Provider Relations and Network Development, and Provider Accountability. Chuck Hill is the manager of our Provider Relations and Network Development section, and I'll let Chuck give you a brief overview of what that division, what that section does.
Morning. So I think most of you know who I am and have. Is there anybody who has not had contact with their provider relations specialist? Wonderful. No hands going up. Either that or you're embarrassed to say it. Wanted to talk a little bit about the duties and responsibilities of the Provider Relations Network Development Unit. One of our primary responsibilities is the credentialing and re-credentialing of providers. As you know, we use MedVersant as our application and credentials verification organization. Once they've completed their processes, it actually has to come back to us. We have to review their information that they've provided to us, which includes all primary source verification and all the database checks. And then that has to be routed through our credentialing specialist to make sure that all of our I's are dotted and T's are crossed, and they go to the credentialing committee so that we can credential not just individual practitioners, but your agencies, group practices, and hospitals. You have to be credentialed by us before you can go on to the contracting process, which is we handle both Medicaid and state-funded contracts. And for those of you who have state-funded contracts, we are in the process of getting those ready to go out to you. We complete contract amendments as necessary. We conduct the initial site reviews for the contract process, so that if you're just entering into a contract with us, one of the provider relations specialists will be contacting you to come out and do a health and safety review and make sure that we've done our part of the Gold Star provider process, which you'll hear about in a little bit. We serve as the primary contact for providers in regard to consultation for contract compliance and other contract issues. Each provider is assigned to a provider relations specialist. So if you don't know who your provider relations specialist please contact us. We'll make sure you know who it is. We're responsible for doing the capacity studies and the community needs assessment. This is one of the most important things we do, because this tells us if we have enough providers of all the different types of services we're required to ensure are provided within the network. We're required to do this at least annually, and we will be doing this coming up in the near future. We're also responsible for conducting RFPs for new services and gaps in services. And so we currently have an RFP that's underway for youth treatment court. We have about 4 or 5 other RFPs that will be coming out during the next 30 to 60 days. Those will be announced through the hot sheet.
And on the provider accountability side, my 2 managers in that section are Kim Alexander and Angie Jackson. And I'll let you talk about your particular area.
Good morning. I think we need to do the agenda by height next time. Provider accountability, a lot of you all know who we used to be. We were once called provider relations, and we were service analysts. So we want you to erase that from your brain. We're no longer called service analysts. They're called regulatory compliance analysts. Some of the things that we do are conducting routine monitorings of all public mental health agencies. We conduct program post-payment reviews, respond to provider complaints, conduct focus monitoring reviews, follow-up reviews to plans of corrections, and we serve as the primary contacts for issues concerning monitoring. Some of the staff you know used to be assigned providers. We no longer have provider assignments. We do it on a rotation basis. So the person you see coming to do your monitoring one year may not be the same person that does it the next year. It's a rotation. So just want you to know that, get to know all these lovely people, because you never know who's going to be the one doing your monitoring. So we're going to introduce our staff, and y'all can just give a little Miss America wave, or Mr. America wave, sorry. Denise Polk, she's one of our team leads. Melanie Cannon. Kathy Cunningham. Carnes Essex. Sharice Johnson. Selena Thaggart. Dana Frakes, who's also a team lead. Kelly Anderson. Melissa Friedman. Dondi Jones. Zenobia Pettis. Miguel Fabian. And Lakeisha Suber. And our administrative support person is Gwen Drayton. She's actually in the back running. She's our technical assistant today. And then we're going to start with the Gold Star monitoring. Angie Jackson will. Do you want to say something?
Yes.
Okay.
I'm going to say a couple things before we actually get into the presentation, and to kind of bring this back to what Phil was talking about in terms of the 5 rights. How many of you know what the Gold Star monitoring process is all about? Good. How many of you have been on the website and have actually looked at the check sheets that relate specifically to the services that you provide? Excellent. Now that you've done that, and when you think about what that process is, what comes to mind in the context of the 5 rights? Why is this protocol, why is this process important to us? Why is it in place? Why do we do it? Any thoughts? Oh, okay. Anyone want a prize? What is this about? When it comes, the bottom line, what is this about? Louder? Did I hear someone say quality? Okay. One of the challenges that I would like to give to you is a challenge that we're working through internally as MeckLINK, is really looking at all of our business processes, all of our clinical practices, and talking about it in the context of those 5 rights. Who is it that needs the service? What is the service they're getting? Is that a service appropriate at the time that they need the service? Are they getting it when they need it? What are the outcomes that they're achieving? This is about the consumers that we're all here to serve and support and help them achieve the life goals that they want to achieve. So when you think about the Gold Star monitoring process, I really would like to challenge you to think about it as your opportunity to demonstrate as a provider that you're in fact living those 5 rights, and that at the center of what you do is the consumers and the families that you serve. And when we come out to monitor, it's not just about a monitoring compliance process. It's really about you demonstrating how you've achieved that and us being able to validate that's in fact what you've done. So as we go through the presentation this morning, I'd really like you to kind of think about it in that context and use that as the context we think about as we move forward. Angie?
Good morning. Can you hear me? Okay. I've been doing a mic check all morning, and they keep saying they couldn't hear me in the back. So can you hear me now? Okay. Unlike Melissa, we don't have any tangible prizes that you can take away from our presentation today, but we do hope that at the end of our Gold Star Monitoring presentation that you will be able to take away information that will help your agency to effectively show the quality services that you are providing to our consumers. I do want to reiterate that in the hot sheet, this presentation that we're going to do today is specifically for agencies. LIP and group practice providers, if you are here today, we do apologize as far as the Gold Star monitoring piece. It is not focused to your business today, but we will have a special session in InfoShare specifically for you to talk about Gold Star as it relates to LIPs and groups, because the tools are different depending on the type of provider that you are. Also, if you have questions during this presentation, we did ask that people submit questions prior to, and we did get quite a few questions submitted. If there are questions that come up during the presentation, there are question cards on your table, and we strongly encourage you to write those questions down, because we do want all questions in writing today. We want to take those back and we want to share them with the group. We're going to post them on our website, and we will also send them out in the hot sheet, and we want to make sure that we give the answers to the questions, but that everybody can have those answers. Okay, for last July, the state eliminated the state eliminated the use of the provider monitoring tool and the frequency and extent monitoring tool, and those were the PMT and the FIM that we all knew, and those were the tools that our provider relations staff used for routine monitoring, and the FIM tool was used to help to determine how often we would monitor an agency. In its place, the state adopted the Gold Star monitoring tools from Cardinal Innovations Health Solutions, formerly known as Piedmont Behavioral Healthcare. And legislation clearly states that all LMEs and MCOs will adhere to the PBH model. With that, DHHS has worked with Cardinal Innovations to modify and enhance the Gold Star monitoring tools. They've also solicited representation and feedback from LMEs and MCOs to serve on focus groups and independent peer groups to review the tools, and MeckLINK has been a part of that process. Also, there's been coordination with DHSR and Also, there's been coordination with DHSR and LMEs to help to eliminate duplication in monitoring. And I know that there's been a lot of talk across the state with providers about how do we eliminate one regulatory body coming out and monitoring the same types of things. So there has been coordination with DHSR for LMEs and MCOs, and as a result of that, we are getting copies of the DHSR monitorings that are done by DHSR. So if DHSR has been out to monitor a licensed facility in the previous 15 months before the LME MCO comes out to do your Gold Star monitoring, then what that means for the provider is that during the initial and routine monitoring phases, we will not conduct the regulatory compliance, we will not use the regulatory compliance tools of the Gold Star monitoring process to do your monitoring for those services. We will use the post-payment review tool, and we'll talk more about that in a little bit. Effective April 1st of 2013, DHHS revised the Gold Star monitoring tools. And so I want to point that out and make sure that everybody is aware, because if you've had Gold Star monitorings prior to April 1st of this year, then the tools that were used during the monitoring have been revised. And so they may look different. So Dennis asked earlier how many people have had the opportunity to go out to the state website and look at those tools. If you haven't looked at them since April 1st, I would really encourage you to please go out there and look. I will also just put in a little caveat that they're getting revised again. We were just in a Gold Star monitoring training last week with the state and trying to work out some kinks and things that are going on. I think my slides are moving. But they're going to be revised again, and when that happens, we will put it out on our website and let you all know that through the hot sheet so that you can check those out. Can everybody see this slide? I know it's a lot on there, but I'm going to read it to you because I think it's very important that you understand some of the changes that have happened with the Gold Star process in comparison to what you may have been used to with the provider monitoring tool and the FIM. There are some policies and provider expectations cited within the review tools that help to directly address a number of qualitative measures. Okay. It's moving. Okay. Technology. Okay. But there are some policies and provider expectations cited within the review tools that help to directly address a number of qualitative measures that are not necessarily found in rule per se, but nevertheless reflect best practice, evidence-based practice standards, and guidelines. Some of these policies are grounded in rule and may even reference some of the specific rules or statutes, while some items monitored during the Gold Star process assess compliance with LME, MCO contract requirements, the American with Disability Act, specific Centers for Medicare and Medicaid Services requirements, national accreditation standards, clinical coverage policies, that's clinical coverage policy 8A through 8O, the records management and documentation manual, and DMH, DD, SAS implementation updates. So the difference here is that with the provider monitoring tool, you were used to us being able to say, if you said, well, show me why that's wrong, we could say, because it's in this rule or it was in the clinical coverage policy. Well, in addition to that, with Gold Star, it may not necessarily be in the rule, it may not be in the clinical coverage policy / service definition, but it may be linked to your provider contract that you signed with us effective March 1st. It may be something that was in an implementation update, or it may be a best practice. The good thing is that with all of these tools, there are guides that go along with them that will show you which guidelines we are using, and if it's best practice, it will say best practice. If it is in your contract, it will say in your contract. The Gold Star monitoring applies to two types of contracted providers: the provider agencies and licensed independent practitioners. With this also includes the group practices. The focus of the monitoring tools is regulatory compliance, quality performance, documentation, and program integrity. Or integrity and billing, I'm sorry. The phases of the Gold Star monitoring are entry into the provider network, and that's with the initial enrollment process. For many of you, when you entered into our network, if you required a policy and procedure review, the Gold Star monitoring tool for policy and procedure manuals review was used to do that review of your policy and procedure. Also, if you had licensed facilities or residential facilities, the Gold Star health and safety review tools were used for those on-site reviews that we did prior to going live. And Chuck also mentioned that if you add services to your contract, and there's a requirement for the Gold Star tools to be used as well. There's also the initial implementation reviews that we will talk about more in just a moment. All contracted providers of direct services will have an initial review, with the exception of ICF IDD services, which DHSR mental health licensure section will do the regulatory compliance review of that. Hospital services, DHSR acute and home care section will do the regulatory compliance monitoring for that. And then ACT services, most recently we've been informed, DHHS will do the monitoring of that because there is a new definition coming out. Hope all you ACT providers know that. That will be, there's a TMAC model that providers are required to follow, and so the state will be making sure that they are overseeing the monitoring of the fidelity to that model. There will be routine reviews that will come up after year 1. And then there's the advanced placement on the provider performance profile, where a provider can choose to be a preferred, exceptional, or gold star provider, and we will talk a little bit more about that in future slides. And then there's also the request to expand the provider service array, where the gold star monitoring tools will be utilized. The implementation review. That is the initial monitoring that will occur for all providers during year 1. This occurs 90 days after the first reimbursement has been made on claims submitted by the provider. And that means claims that have been submitted to us starting March 1st of 2013. The sample size will be 10 dates of service, and that sample size will drive the consumer records that will be pulled for the review. And then also the staff that work with those consumers will determine the personnel records that we will look at for that review. The look-back period will be the previous 6 months, or if you have a review before September 1st of 2013, the look-back period will be March 1st to present. Successful completion of the review will be required, a provider will be required to have 85% or higher in order to move to routine status. Routine reviews will occur annually, and that will start in year 2 of the waiver. And when we're talking in years, we're talking after March 1st of 2014, that's when we will start doing the routine reviews. The sample size for routine reviews will be 30 dates of service, and again, that will determine the consumer records that we will look at, and from those consumer records, the staff that work with those consumers, we will need to see all of those personnel records for the look-back period. So if it's the last 6 months, we need to see every staff that work with that consumer for that 6-month period, or you need to have those records available to us. Successful completion of the routine review, you will be required to have 85% or higher. And once the routine review is completed, provider can stay on routine status, or they can request to move to an advanced status. Okay, I'm going to talk a little bit about the monitoring tools for the initial and routine reviews. For those of you who've gone out to the website, you know that there is a very complex workbook that's out there, and so we are going to have my trusty assistant Denise in the back to pull that up in just a moment. And I'm just going to go through the list of the tools. The rights notification and funds management tool, and this is for the funds management part of this tool will only be used for providers who manage or oversee consumer funds. The rights notification will be used, but if you don't oversee or manage funds, then all those questions will be considered not applicable for your agency. The record review, which is the consumer record, the personnel review, the medication review, and this is only for agencies who administer or store medication. If you do not administer or store medication, then we will not rate you on that check sheet. The health, safety, and compliance review, this will be for licensed and residential providers, and we will only use this tool if DHSR has not been out to review your licensed facility within the previous 15 months before we come to do the review. There will also be an AFL health and safety review. This will be for non-innovations AFLs as well as AFLs under the innovations waiver. If you don't have AFLs, we will not use this tool for your agency. Then there's the cultural competency review tool. That will be used after year 1. The state is still in the process of finalizing those tools, so once those are finalized, we will bring that information back to a future InfoShare and present that to providers. And then lastly, there's the post-payment review tool that will be used. There are 4 tools that are on the slide, and when we flip back to it, you'll see that have asterisks by them. Those 4 tools will be used for every review and for every provider type, except for the 3 exceptions that I mentioned on the previous slide. That's the rights notification and funds management tool, the record review, the personnel review, and the post-payment review. And so you will see that Denise has been flipping through showing you the tools on the state website. You have to page over to the right to make sure that you see all of the tools. There are 8 tools that we could potentially use for an agency. And there's additional tools that Kim will talk about that go with the post-payment review tools. I think the guidelines tab that's right after the instructions is very important because it is a PDF document. But these are the same guidelines that regulatory compliance analysts will use to rate each question. And so there's no secret, they're already out there. You will know before we get to your agency what we are looking for and what evidence you need to provide to us. And there's an accompanying guide for every worksheet. Okay, I'm going to talk a little bit about the post-payment review tool. Every Gold Star monitoring that we do will have a post-payment review. So I'm just going to let you know a little bit about what the post-payment reviews are for, and they are just to assure that payments are made for services delivered to beneficiaries. Any overpayments identified by this review are required to be recouped or collected. PPR involve examination of claims, payment data, medical record documentation, financial records, administrative research, application of Medicaid, coverage policies, and any additional information to support providers' operations and processes. Post-payment reviews can be conducted as a desk review or on-site. The PPR are about monitoring the providers to make sure they are in compliance with clinical coverage policies, state, federal rules and regulations. And also the tools can be used to conduct special audits or investigations related to integrity activities, program integrity activities in accordance with the DHHS, LME, MCO contracts, and 42 CFR. So we're going to look at some of the post-payment review tools. There are individual tools for the following services: child and adolescent day treatment. And Denise, if you could just go to the workbook so they can kind of see where they're located. Child and adolescent day treatment, diagnostic assessment, innovations, the LIP post-payment review tool that we're not talking about today, outpatient opioid treatment, PRTF, residential services, which is strictly child residential, child mental health level 2, 3, and 4, and the generic tool. The generic tool is used to review more than one service. So the following services are used on the generic tool as ambulatory detox, ACT, which is PPR review only. We will not do the Gold Star for ACT or ICF-IDD, but we will do post-payment review for those 2 services. Also, there's another one added, the supported employment long-term vocational service that is coming up as part of the DOJ settlement. We also will be doing post-payment on that service, but we will not be doing the Gold Star for that service. That's not on the slide, but I just thought I'd throw that in there. Community support team, intensive in-home services, medically supervised or ADATC, detox, crisis stabilization, mobile crisis management, MST, non-hospital medical detox, outpatient for agencies. So if you do services, enhanced services plus outpatient services, if you're an agency provider, we will do the generic tool for those outpatient services. Only the LIP tool will be used for outpatient for independent practitioners. So we're not using that tool for agency providers. Partial hospitalization, peer support services, professional treatment services in facility-based crisis program, PSR, SACOT, SAIOP, substance abuse, non-medical community residential, substance abuse medically monitored community residential, and state-funded services. So that could be your day activity, your CATE, all those services. We will be using the generic tool for those services. With the post-payment, there are review worksheets, so it's like tools inside of tools inside of tools that we have to use to do this post-payment review. One of them is about staffing ratios, and that is specific to child residential treatment. Once again, except therapeutic foster care. We will not use the staffing ratio check sheets for that. And a staffing qualification check sheet. So each time we do a post-payment, we will have to look at the personnel and use the staff qualifications check sheet to go along to answer some of the questions that go back to the actual post-payment review tool. And not all services have a staff qualification check sheet, but the following services do. And yeah, you can see them. So they're ambulatory detox again, ACT, community support team, facility-based crisis, intensive in-home innovations, medically supervised or ADATC detox and crisis stabilization, mobile crisis, MST, non-hospital, medical detox, partial hospitalization, peer support, professional treatment services and facility-based crisis, PSR, SACOT, SAIOP, substance abuse, non-medical community residential treatment. All of those have a specific staff qualification check sheet. And so what we will do, even though it's a data service, we do look, if it's a team service, we will look at every staff on that team for that date of service. So just be mindful of that, that even though one person may have signed the note for that date of service, we will be looking at a team component if it's a team service. So we will look at all those staff records. It doesn't matter if it's 3 staff or, for ACT, if it's 7 to 10 staff, we will look at all those staff records. So just be prepared for that. So next we will be talking about, Angie will be talking about the advanced placement part of the Gold Star.
Okay. For advanced placement is voluntary. It is requested by the provider. It is not pushed upon you by the LME MCO. After we complete your initial review, if you get 85% or higher, you can move to routine monitoring and you can stay at being monitored annually if that's what you choose. If you choose to move to a higher level within the Gold Star monitoring process, then there are minimum prerequisites for length of time in the public mental health DDSA system that you have to meet. In order to move to preferred status, you have to have at least 1 year. Exceptional status, 2 years. And for Gold Star, you need to have at least 3 years. The years of credit are not confined exclusively to the provider's tenure in the LME MCO network, which the provider is applying for advanced placement. Other credible years of service, such as you were under a provider contract with another LME MCO, or the length of time enrolled as a Medicaid provider, can also be used toward that length of service. But of course, we would have to verify that. We would need some evidence to verify that. And I'm sure this is a question that many of you are thinking. Is it possible to apply for advanced standing right after I have my initial review? Yes, it is. However, the following must occur. First, you have to have that initial implementation review and you have to pass it. That's the plan of correction process if you have to go through a plan of correction. The provider does not skip ahead to a higher level in applying for advanced standing. The provider must also demonstrate that the agency meets the requirements of all other intervening levels. And this means that if you are already Gold Star in another LME MCO catchment area, and after you have your initial review with MeckLINK, you say, I want to strive to be a Gold Star provider in MeckLINK's network as well. You may do that, but you will have to complete all of the worksheets that go along for preferred, exceptional, as well as Gold Star, and receive the scores that are required on those worksheets. What are the benefits of advanced placement? The frequency and monitoring is one. If you move to preferred status, the LME MCO would conduct routine monitoring every 2 years for your agency. If you're exceptional, every 3 years. If you're Gold Star, every 3 years. Also, the tools, you saw all those tools that were up on the screen that Denise was running through. There will be less tools that the LME MCO would use to monitor your agency. In place of the initial and routine monitoring tools that you saw on the screen, there would be a domain review tool for the specific status that you hold. The cultural competency tool, which will be a part of the Gold Star monitoring, will be used for every provider, as well as the post-payment review tools. Phases of the Gold Star monitoring will be a self-assessment that the provider will be required to complete. Then the MCO would take that information and complete a desk review. After that has been completed, then the MCO would do an on-site verification at the provider site. The state is in the process of revising and finalizing the Gold Star advanced placement tools. So once those have been revised and finalized, we will post that information in our hot sheet, and we will bring that information back to you at a later InfoShare. But right now, everybody just needs to focus on the initial monitoring that will be taking place in year 1. Okay, Kim's going to come and talk to you about the Gold Star monitoring scheduling.
We have begun scheduling Gold Star monitorings. So if you haven't been notified, just wait, your turn's coming. The provider notification, we are given at least 4 weeks notice, just because there is a lot of information that you will have to pull together for the review, so we just want to make sure you have ample time to do that. For the record review, you will get notice 1 week before the review. And the reviews will begin the week of June 10th. Those providers have already been notified. So just be ready when we come out there. We'll be coming out soon. We also have developed some handouts for you that we thought would be helpful. Some of the items on the Gold Star are items that we haven't reviewed before. So we just wanted to do a handout for you, and we called it What's New, things that we've never monitored from a PMT or the FEM. So we just want to make sure that you are aware of those new items so that you can be prepared when we come out, so they're not a surprise. So if you could raise your hand, we're going to start handing these out. We didn't make a lot of copies. We are posting them on the website, but we want to hand out 1 per agency for the What's New. And we also have helpful reminders. This is also a handout that we've developed just to, hold on one second, that we've developed for frequently missed items on previous reviews from providers. So these are things that have always been in place and always been a part of the review, but they haven't always been, as successful as we would like them. So we also developed a tool just for that. So if you could just raise your hands, we'll start passing those out. So we're not waiting to the end. We also have the PowerPoint and the Q&A will be posted on our website for you to review, and if you want to take a look at that and use this to pass along to your staff, that would be great. Also, the Gold Star monitoring link is on the PowerPoint, and the frequently asked questions are on the PowerPoint. So if you have questions, please write them down. We want to make sure that we answer all of your questions. Could you move to the next slide? Answer all your questions, because you know we like things in writing, so we want to give it to you in writing. So if you could please just put your questions down. We'll make sure that they are posted on the website as soon as possible. We did get questions already, and we will be posting them.
We're going to go through, actually, I'm going to read aloud. You guys are going to answer aloud the ones that came through already.
Okay.
Dennis said that right before we started.
Okay.
And then we'll collect cards and we'll hold the cards.
Okay.
Not answer.
So some of the questions that already came in, do you want me to just read them?
That's great, if you want to.
Okay, I have them. How does the Gold Star monitoring process affect ICF IDD? We just talked about that a little earlier. We will only do the post-payment review for ICF providers. Our organization was just recognized as Gold Star provider from Cardinal. Will MeckLINK need to review all of the same information or just the records billing information unique to MeckLINK?
The answer to that, as I'd stated earlier, is all providers are considered provisional in each LME MCO network until they have successfully completed an implementation review. If you are recognized as Gold Star provider in another LME MCO catchment area, you may request to move from routine to Gold Star status. However, in applying for the advanced standing, the provider must also demonstrate that the agency meets the requirements of all the other intervening levels, and this includes successful completion of all advanced placement tools for the provider. Okay, are there any benefits to being a Gold Star provider? Other than the obvious, such as recognition, such as preferential consideration for expansion of services. Providers who achieve advanced placement will receive less frequent monitoring, and the monitoring tools will only consist of domain tools applicable to the provider status, along with the cultural competency and post-payment tools. Providers who achieve preferred status will receive routine monitoring every 2 years, exceptional and Gold Star every 3 years. Providers who achieve advanced placement do not automatically receive preferential consideration for expansion of services. If there is a need for expansion of services, as Chuck said earlier, within the MeckLINK Behavioral Health Network, this will be handled by a request for proposal process that will be posted in our website and in our hot sheet.
The next question we had was, how far in advance will we be notified? And that was answered 4 weeks. Is there any flexibility in the scheduling of the review? Provider accountability staff will make every attempt to be flexible when scheduling within available resources and mandated timeframes. So you are getting 4 weeks notice. You know, we'll try to be as flexible as we can, but we really are on a kind of a tight schedule to get everyone reviewed within the first year. We have 360 some odd providers, so if you can just do the math with the number of staff we have, we're really kind of on a tight schedule. So when we notify you, we want you to be ready. But, you know, I know life happens, so we'll take that into consideration.